Okay, this morning we are going to process in this new arrival at our Texas facility. What we do is we're going to microchip, give a tetanus shot, and deworm, make sure our paperwork's filled out so she can go into our computer system.
Okay. You check your AVID, make sure there's one in there.
That's the AVID number for that chip.
Okay.
And what we do is now this old girl, as you can see, has got kind of a fat neck on her. So we're going to go in that line, right under that neck, right in the center. We pull the skin away, and this is a subcutaneous shot. It goes under the skin so that chip stays lodged close to the surface. Once it's out, we rake the area. That ensures that the chip turns a little bit and doesn't work its way out that giant hole we just made in her neck. You can tell it doesn't really hurt her that much, even though it's a big shot. Next up, we're going to give a tetanus shot. If you draw a line up her shoulder, along her neck, and then back to the starting point, and use that as a bullseye target right in the middle of there, and we stick it deep into the muscle. Aspirate the syringe to make sure you haven't hit any blood vessels, and then set the plunger. We rub the area to help disperse the medicine into the muscle there and break it up a little bit. And finally, we're going to give some deworming paste. The paste is set for a 1,200-pound horse, so we use half of that dose for a standard donkey. What we do is we put it in the inner dental of her mouth, which is in between her front teeth and her back teeth. There's a gap there.
She might not let us do it.
She's not going to like us doing that.
Okay, it's right in here.
Right in there, there's a gap. You put the worming syringe through that gap towards the back of her throat, and then set the plunger. And she's just going to work it around, but because it's a paste, the more she licks it like that, the more she disperses it over her tongue, and she'll get it all ingested that way. And we need to do that every 3 months. And that's about the end of the process. That donkey's ready to have her origin information, any medical history we have, put into the system.